muscles or the small muscles we have. We have the intrinsic or small muscles, and we have the extrinsic muscles, which are a larger group of muscles. So for this first part, I'm going to focus on the intrinsic muscles. There's four main groups of muscles that you really need to know. For the intrinsic, there's the thenar eminence, the hypothenar eminence, the interossi, and the lumbricals. Okay, can you see there's the thenar eminence here on the side of the thumb in the picture, and there's the hypothenar eminence on the side of the pinky, the little finger. Okay, so this is the thenar eminence, the hypothenar eminence. Next slide. You can see here on the left side in the muscles that are colored in green, these are the lumbricals, okay? And on this side here, you see the interossi. Interossi, inter means between, ossi means bones. So interossi, muscles between the bones, the metacarpal specifically. This pad, dab, mnemonic thing, I'll explain in a bit. So just remember the intrinsic muscles of the hand. You have the thenar eminence, hypothenar eminence, interossi, and the lumbricals, okay? Next slide, please. So the thenar eminence is a group of muscles, as I said, on the side of the thumb. It's the part sort of beside your thumb where your hand is a bit raised. You can see it on your own hand. There's three main muscles here. Abductor pollicis brevis, flexor pollicis brevis, opponens pollicis. All of these muscles, if you look at the name, it tells you what the muscles are. So we have abductor pollicis brevis will abduct the thumb, flexor pollicis brevis flex the thumb, opponens pollicis is for opposition, which is moving the thumb basically towards the pinky. And do you remember the rule I put at the start where I said anything usually on the side of the thumb will be supplied by median nerve? So that will help you here. So the nerve supplied, the thenar eminence is the median nerve. Okay, next slide. The hypothenar eminence is the raised part on the side of the pinky or the little finger. And again, the muscles tell you exactly what each one does. So abductor digiti minimi for abduction of the little finger, flexor digiti minimi for flexion of the little finger, opponens digiti minimi for opposition of the little finger. Again, because it's on the side of the pinky, it's supplied by the ulnar nerve. Okay. Next slide. The interossi. So for the interossi, as I said, inter means between ossi bones, so they're the muscles between the metacarpals. These muscles, we have dorsal interossi and palmar interossi. Dorsal is the back of your hand, palmar is the other side of your hand, okay? So the easy way to remember this is the mnemonic dab and pad. So dab for dorsal abduct, D-A-B. Dorsal interossi abduct, dab. And the opposite, palmar, will adduct. So palmar adducts, P-A-D. So dab and pad, I will remind you of the function of the different interossi. And for interossi, all of them, all four of them are supplied by the ulnar nerve. Okay. Next, okay, there's some questions in the chat, I think. Okay, never mind. Okay, next slide. The last group is called the lumbricals. So the lumbricals flex at the MCP, the metacarpophalangeal joint, and extend at the interphalangeal joint. Okay, so if you look at the picture, you can see this is basically the movement that's being done by the. Let me just turn on my camera. Can you see me?
Yes.
Okay. Can you see my hands moving? Okay.
Yeah.
What I'm doing with my hands, this is what the lumbricals do, basically. Okay. Stop my video. Okay, next slide. So now we just want to quickly review what we've talked about so far, just to make sure it's clear. Would anyone like to quickly review what we've talked about so far, or should I review it? Any volunteers? Okay, so I'll just review very quickly. We said the hand, we have intrinsic and extrinsic muscles. So far, we've only talked about the intrinsic muscles. We have the intrinsic muscles. The first group we talked about are the thenar eminence. We said it's made of the abductor pollicis brevis, flexor pollicis brevis, opponens pollicis. And because it's on the side of the thumb, it's supplied by the median nerve. The hypothenar eminence is on the other side, so it's supplied by the ulnar nerve. And the names of the muscles are basically the same, except we put digiti minimi instead of pollicis. So abductor digiti minimi, flexor digiti minimi, opponens digiti minimi. Then we said we have muscles called interossi, which are between the metacarpal. We have dorsal interossi that abduct, palmar interossi that adduct. So dab and pad, and all of them are supplied by the ulnar nerve. And then lastly, we said we have muscles called the lumbricals, which flex at the metacarpophalangeal joints and extend at the interphalangeal joints. And I showed you with my hands exactly what that looks like. And the ones on the median side, basically the side of the pinky, are supplied by the ulnar nerve, and the ones on the lateral side are supplied by the median nerve. Is everything clear so far? Okay, yes, okay, thank you, Saeed, Asil, thank you. So the next part, if Momo, you can go to the next slide. So the extrinsic muscles of the hand, remember I told you we also have extrinsic muscles. The main things these do, they move the digits, either flexion or extension of the digits, and flexion extension of the wrist. So the muscles that flex the digits are called flexor digitorum. Okay, you can see them in the top picture here, flexor digitorum. The ones that extend the digits are called extensor digitorum. So flexor digitorum, extensor digitorum. For the flexor digitorum, again, the same rule we talked about before. The two digits on the median side. I'm not talking about the thumb here, like the other four fingers. The two ones that are most median or on the side of the pinky are supplied by the ulnar nerve, and the ones that are towards the thumb are supplied by the median nerve. Okay, so it's the same rule we talked about before. Extensors, I think a general rule to remember, radial nerve is sort of a nerve that's almost designed for extension. It extends the arm with the tricep is by the radial nerve. Extensor digitorum for extending the digits is by the radial nerve. And you also see the wrist extension is also by the radial nerve. So extending at the elbow, at the wrist, at the digits is all by the radial nerve. Okay. Next slide, please. So the other extrinsic muscles, we already talked about the ones that flex and extend the digits. These are the ones that flex and extend the wrist. So we have flexor carpi radialis and flexor carpi ulnaris. These are the wrist flexors supplied by the median and ulnar nerves. Okay. And we have the wrist extensors. Their names are here. I'm not going to read them, but this is what they're called. And they're supplied by the radial nerve because we said the radial nerve is the nerve for extension. Okay. Next slide. Okay. Go back. Yeah. I want someone to quickly review what I talked about in the last part about the extrinsic muscles of the hand. Anyone? Yes, Sayed Idris, you're correct. Extensor muscles are bigger. We have flexor and extensor digitorum. These are for the digits. Okay. For flexor, medial digits is ulnar, lateral is median. Okay, Sayed, thank you. And what about the extensors? What nerve supplies the extensors? Radial. Okay, perfect. Perfect. Thank you, Said. Everyone else is clear so far? Yeah. I'm just taking I know I'm taking a lot of time just to keep reiterating, but it's just because the topic can be difficult to understand sometimes. Conceptually, it's not easy, so if you understand it, it's good. So we're done the most difficult part of the lecture. The rest of it is really a piece of cake. So just go to the next slide, please, Momo. So far we've talked about the motor supplied to the hand, the motor nerves, the median, ulnar, that supply the muscle. But you also have to remember the sensory supply to the hand. And really, this slide, you really just need to memorize it, to be honest. You know, the ulnar nerve here is on the thumb side. The lateral 3.5 digits on the palmar side are supplied by the median nerve. This is something, a classic description you need to remember. For certain diseases, they will tell you sometimes the first three, like the lateral 3.5 digits are affected, so you know it's the median nerve. And on the back, you see where the area where the radial nerve is supplying as well. So probably next year, when you're doing neuro, you'll be doing the neurological exam. You'll be focusing on these dermatomes. You'll have to know how to test each dermatome, where to put. If you're trying to test, for example, the touch sensation, which parts to touch to see if the patient's sensation is intact. So it's important to know this. Okay, next slide, please. Wait, so we've talked a lot about the different muscles and the nerves that supply them. So now, to be honest, I think all of you should have an idea what would happen if each, like for example, if the median nerve was damaged, if the ulnar nerve was damaged, if the radial nerve was damaged, you should have an idea of what that would look like. But here I went through it step by step, just so you know. So median nerve damage, we have something called the hand of benediction or the Pope's blessing. You can see the picture at the bottom. Basically, the things, first of all, because median nerve supplies the thenar eminence, this is the very first thing we talked about. So it means the thumb won't be able to move. And also the thenar eminence will be like atrophied. We said the lateral 2 lumbricals are supplied by the median nerve. So the lateral 2 digits will be clawed, which is basically the index and the middle finger. I'm not talking about the thumb here. So they'll be clawed. Maybe it's not that clear in this picture. If the patient tried to make a fist, you would have clawing of these digits because the lumbricals are affected. Sensory loss in the lateral 3.5 fingers. Again, this is because of the median nerve. And the result of this is something called the hand of benediction. Can you go to the next slide? Is it clear? Is the median nerve injury clear?
Yes, it's clear.
Okay, someone said yes, we'll continue. So can you go to the next slide? Back, sorry. Yes, this slide. So this slide, I don't know, to be honest, they'll ask you this in the exam, but just in case you see it anywhere, I just put it for you. So there's something called the recurrent branch of the median nerve. It's a branch of the median nerve that supplies only the muscles, only the thenar eminence. Does not give sensory supply. Why is this important? Because if this nerve is affected, it's quite a superficial nerve. So if someone is cut or something like superficially, this nerve can be affected. And what this patient would have, they would not be able to move their thumb. They may have atrophied thenar eminence, but compared to like the usual median nerve injury, sensory would be completely intact because this nerve only has motor supply. Next slide, please. Ulnar nerve. Again, you try to think to yourself, what does the ulnar nerve supply? And it will give you an idea what happens if the ulnar nerve is not. First of all, we said the interossei, remember the dab and pad muscles? We said all of them are supplied by the ulnar nerve. So the fingers cannot be abducted or adducted, okay? So I have a question, just someone quickly answer me. Finger abduction and adduction, what are the muscles responsible? You can write in the chat or you can shout out the answer, I don't mind.
Palmar and dorsal interossei.
Yes. And which one adducts? Which one abducts?
The dorsal interossei abduct and the palmar interossei adduct.
Thank you. Perfect. So inshallah, Huzaifa, you'll be getting an A on your MSK exam, inshallah. Hypothenar, remember we said because it's on the side of the pinky, so it's supplied by the ulnar nerve, so you have motor loss to the hypothenar. So the pinky or the digiti minimi, you can't move it. The medial two lumbricals are affected. Again, ulnar nerve supplies things on the side of the pinky, which is more medial. So these are affected, so these fingers will be clawed. Remember we said in the median nerve injury, the lateral finger will be clawed. Here is the opposite. And the last thing, of course, sensory loss to the little finger, because can you go back to the slide of sensory supply, Momo, please? So you can see the lateral 3.5 is by the median, and the last, like sort of the last digit here on the side is by the ulnar. Okay. Next slide. So this is just a review of the different presentations. I didn't talk about the radial nerve, but remember we said radial nerve is for wrist extension. So if you lose the radial nerve, the wrist can't be extended up, so it just drops like this. We call it wrist drop. So when I was doing MSK, when I was in your stage, like not that long ago, not that old, but I didn't really see this mnemonic, but I think it's very helpful. The doctor humor. So like DR, wrist drop, radial, ulnar C. So you can see the mnemonic here. So I think it might be helpful to you. And it's the first time I saw it when I was just looking for this picture. Okay, so everyone's clear?
Okay, thank you.
Okay, thank you. Carpal tunnel syndrome. Can you go to the next slide? Thank you. So carpal tunnel syndrome. Does anyone know what carpal tunnel syndrome is? Anyone can answer, just if you know what carpal tunnel syndrome is, or if you know anything about carpal tunnel syndrome. Compression of median nerve. Yes, you're right. Compression by what? Okay. Okay, Jamil, yes, you're correct. So basically, and fluid buildup, yes. Okay. So both of you are correct, mashallah. But just to put what you said together, it's compression of the medial nerve under something called the flexor retinaculum, or the transverse carpal ligament. You can see the picture here, the white thing coming across. So you can imagine, as our friend Jamil said, if there's like pressure buildup in the hand, or if there's a lot of fluid, which happens during pregnancy, okay? So this carpal tunnel syndrome is common in pregnant women. So it will start to swell up and there'll be pressure buildup and the flexor retinaculum will be pushing against the median nerve and it's going to cause median nerve damage. I need someone to tell me what will be the symptoms of carpal tunnel syndrome.
I think there will be swelling around the wrist joint. We will have hand of Benedict, and we'll also have the ape hand, where the hypothenar eminence and the thenar eminence are on the same level.
Okay. Yes, very nice. Thank you, Ismail. So basically what Ismail said, if you know what the median nerve, the functions of the median nerve are, if it's damaged, basically these will be the symptoms of carpal tunnel syndrome. And remember, they always say in exams, the lateral 3.5 fingers are affected. So your thumb, index, middle finger, and half of the ring finger. They usually give you this description for carpal tunnel syndrome. And remember that they might tell you it's a pregnant woman because it's common in pregnant women. Actually, when you do like in fourth year, like your obs and gynae rotation, and you'll see it's common, and they like to ask about it even then. So it's good to know it now. طيب, next slide. This is the last part of our lecture. These are the carpal bones. Usually they like to ask these in the OSCE. So sometimes they'll just put an arrow in a bone or something and tell you, ask you to identify the bone, or they might ask you, for example, like, for example, the scaphoid has clinical significance. They might ask you about it. So if you see the mnemonic on top, she looks too pretty, try to catch her. So this is basically just for remembering the bones in order. So if you follow, it's difficult here because the picture is kind of small, but if you follow each bone, who's this? Sayed, can we have 5 minutes break to frame up? Yeah, sure. I just need like a couple of minutes to finish it. So just this mnemonic will help you remember the bones because they're important to remember. And the most important bone of these, this is the last slide, is the scaphoid. Does anyone know the clinical? Can you go to the, no, don't go to the next slide actually. Does anyone know the clinical importance of the scaphoid?
Is it the most commonly fractured carpal bone?
I don't know, Allah, if it's the most common one, but there's a specific. So you're partially part of the answer I'm looking for is fracture. Why is fracture of the scaphoid bone important?
It's going to, I think, I'm not sure, like do something with the radial artery or the radial nerve.
It's articulating with the radius.
You're kind of in and around the answer.
Okay, it kind of articulates around the radius and the ulna, I believe, to allow for movement.
No. Your friend before you mentioned something about the radial artery. The radial artery is important. Yes. We have a seal in the group. Avascular necrosis. Yes. We have 2 people here, 3 people, mashallah. So it's called avascular necrosis. So because the scaphoid receives supply from a branch of the radial artery. So the way to think about it is the branch comes from below the bottom half of the bone, and this supplies the whole scaphoid. So if you imagine, if you fall on an outstretched hand, you'll fracture like the bottom parts of the scaphoid. You fall on it and fracture it. So the radial artery will be affected, and the sort of the upper part of the scaphoid won't be able to get blood supply because it's depending on this branch, and you have something called avascular necrosis. Avascular necrosis, one of the classic presentations they'll tell you is tenderness or pain at the anatomical snuff box. Do you know what the anatomical snuff box is?
Compression of radial nerve.
No, the anatomic snuff box. It's a specific area. Do you know where it is? I'll just turn on my camera.
Yeah, and the thumb.
Yeah.
Below.
Yeah. They taught you about it. You had they explained it to you before.
Yes.
Yeah. So just this is just a side note. They like to ask an OSCE or an MCQ. They like that you know the borders of the anatomical snuff box, the contents, stuff like this. Okay. Next slide. My last slide actually. This just shows you the avascular necrosis as a picture representation. So last I'm done. Does anyone have any questions?
Oh yeah, I had a question.
Yeah,
Did
I
you
have
say anything specific about the snuff box, or are we just talking about the contents?
No, I just said if you have avascular necrosis, there is pain in the anatomical snuff box.
Oh yeah. Okay.
Yeah. The thing is, the anatomical snuff box, I think the floor of the anatomical snuff box, if I'm correct, is made by the scaphoid bone. So it makes sense that you'll have pain there if it's.
Okay, thank you.
In the chat, they're asking if we need to know the anastomosis around the hand.
Did they teach it to you in lectures?
He went through them, Dr. Atif. like fast.
I think the best thing, just if you ask him, if you need to, he'll probably say yes, but I try to cover most of the important things. For the exam, it's better to refer to your lecture, obviously, but I'm not really sure what to tell you. If he focused on it, I would say it's important. But I remember when he gave us the lecture, he didn't spend that much time on it. It was just sort of to
Same.
finish the picture.
Yeah, he just read the names and location. That's all.
Yeah, I think I don't want to say for sure he's not going to ask you, but probably it was just to orient you to like the different structures and stuff in the hand.
And there's one more. Can you give us questions to test us?
I don't have questions at the moment. I can send you a PowerPoint later with questions.
I can send PowerPoint too. So.
Do you have a? What if I just quiz you now? Just to like random questions, very quick. Because like long questions, to be honest, I don't have at the moment.
Yeah, you can.
Okay, I'll give you. I'll just ask you quick, like sort of 4 or 5 questions. Very quickly. Should I pick people to make it fun, or should I just?
You're saying no.
You're saying no. Yeah. Okay. Let's see. Okay. First question. Okay, first question for Harun.
Oh wait, I'm not ready for this, I think.
I'll give you an easy question.
Okay.
So you have someone coming to you to the clinic. They're complaining of numbness in their first 3.5 digits. What's the nerve most likely affected?
It's the median nerve.
Okay, perfect.
Okay.
Okay. Let's see what else.
I have
So,
but I'm not sure if he's stressed. Like, can I ask too? Because I took this last year.
who wants to ask?
No, me. Mom.
What you want to ask them question?
If you don't mind, because I have.
Yeah, sure. Sure.
So which bone is the most commonly fractured? Someone said it.
Scaphoid.
Yeah.
Scaphoid.
Which one is the most commonly dislocated?
Lunate.
Yeah.
Lunate.
Those two, I remember they were important.
So only the scaphoid is articulating with the radius and ulnar.
Yeah. Wait, you
What
can
about the lunate?
Wallahi, I'm not sure. I'm not sure the answer to your question.
No, I believe so. That is right. Scaphoid does. I
It looks
believe,
like it in the
articulate.
picture, but I'm not sure.
No, I checked it. I'm pretty sure.
Yeah, you're probably correct.
And yes, it articulates with both radius and the ulna.
Yes,
Perfect.
yes. Thank you.
Okay. Okay. Who wants to answer the next question?
What's the question?
I'll go for it.
It will be an easy question, inshallah. I'm not like Dr. Atif. Okay. Oh, but don't tell him I said this. Don't look. Okay. Report it. طيب, can you see my hand in the picture?
Yeah.
Okay. My hand is like this. What nerve is affected? If you see a picture of a hand like
Radial nerve. Radial
this.
nerve.
Radial nerve. Thank
Because the
you.
extensors aren't working.
And
Perfect,
hand of
perfect.
benediction is median nerve.
Yes, perfect. They call it also Pope's blessing, I think. Okay. Let's go for one more question. I should have prepared questions, to be honest, but I've been busy the last couple of days. I'm still in the hospital now. I slept like 4 hours yesterday. But anyway, um, uh, let's see. Okay. I'll give you, it's a fairly easy question, this one. Judy, thank you, Doc, go and rest. No, I'm not, don't call me doctor. It makes me feel old. But the
Ask the
carpal tunnel
boundaries
syndrome,
of
the boundaries of the what's the anatomic snuff box, anyone knows them?
Yes. Yes, I do know the boundaries, right?
yes.
Boundaries of the anatomic snuff box.
So
I didn't talk
the
about it, but it's good. It's good to know. It's good to know. They might ask.
so the medial border is going to be the extensor pulsus longus. The lateral border is going to be extensor pulsus brevis and abductor pulsus longus. And the floor is floor is scaphoid and trapezium, and the roof is the skin. I think so.
Perfect,
That's
perfect.
yeah, okay.
And so if you have, just to give you a quick case, you have a 35-year-old pregnant woman coming with
Yep.
pain, You probably know what the answer is already because I said pregnant. She's coming with loss of sensation in the lateral 3.5 fingers. Which structure is responsible for compressing the nerve causing her symptom?
Carpal tunnel syndrome.
Yeah, that's the no, not the syndrome. I believe you're asking about the structure, right?
Yes. What's so
yeah.
what? So let's put it two parts. Make it easy. What's the nerve causing her symptoms?
Median.
The median nerve, yeah, compression of the median nerve.
Okay. And what's the structure that's compressing the median nerve?
Retiniculum.
Yeah,
I'm not sure.
the
Structure is the ligament.
yeah,
Perfect.
the flexor retinaculum, I
Yeah,
think.
flexor retinaculum or transverse
Yes.
carpal ligament. Both are correct. Okay, I'll give you guys a quick break if you want to go pray, eat, anything.
But I just had a question. What will we be doing in the next session?
Next session, embryology, development of the limb.
Okay, thank you.
Yeah, I'll be very quick. It'll be like 20 minutes or something.
Oh, yeah, just thank you.
Yallah.
Will we begin at 6?
Yeah.
What time do you guys want to start? I can start earlier if you guys want to finish earlier. Or
Like
I can start at
5:50.
6, whatever.
Yes, it would be more appreciated
5:50.
if you could start. Yeah,
Is it
earlier,
good?
yeah.
5:50.
Okay.
Yeah,
What do others
5:50
think?
is fine.
5:50? 5:50
Yeah.
is good with everyone?
Yeah, 10
5:50
minutes.
is good. Yes.
Just say yes in the group if you agree so we can have like a democracy.
Will it be on the same meeting?
Yes, same meeting.
Okay.